I want to talk about our results on our experiments on implicit and explicit theory of mind abilities of children and adolescents with high-functioning autism spectrum disorders that we conducted at our Department of Child and Adolescent Psychiatry and Psychotherapy at the University Medical Center in Freiburg, Germany. Our starting point was that we were very impressed by the huge effects that were found in further tests on the theory of mind that were published initially. So our main objective was to test further the theory of mind deficit hypothesis in ASD by using these prominent tasks, calling for implicit and explicit processes, and that we would, we were wondering whether we could replicate these huge effects that were published in the beginning. Because we were not too happy with the matching of these first papers, we also did some or tried to make matching, and so we used or tried to well match the groups with respect to age, gender, and IQ. And before matching, our participants were 22 children with high-functioning autism spectrum disorders in the age range of 4 to 14 years. They had a diagnosis of childhood autism with an IQ level above 70 or Asperger's syndrome. The typical developing children comprised of 40 participants, also in the same age range, and we checked them for having not any psychiatric disorder via the CBCL 4 to 18 and the German screening instrument for autism. So our dependent measures were tests that were already mentioned in previous talks. We used the reading the mind in the eyes test, or eyes test for short. We used the face test and the false belief test. Here you can see the children version comprised in the eyes test 28 photos of the eye region, and the participant has to choose this word that best describes what the person in the photo is thinking or feeling. And in the face test, you have these 20 photos of an actress displaying 10 basic emotions and 10 complex emotional states. For explicit TOM abilities, we used 10 first-order false belief tasks, like the famous Sally-Ann task or the Maxi task, originally developed by Wimmer and Parner in 1983, and additionally 4 second-order false belief tasks where you have to understand what somebody believes about the beliefs of somebody else. Okay, now to the results. Implicit TOM skills. You can see in the upper right corner the matching of the two groups, because for these facial emotional recognition tests, the children have to be at 8 years or older. The sample size is reduced to 12 participants in the TD group and also in the ASD group, 11 male, 1 female. Age was around 11, and the IQ level was around 108 in both groups. So what we found with respect to accuracy was we found no significant differences. In the eyes test, even there was a slightly better performance for the ASD group, as you can see on the left side, and for the faces test there was also only a little difference between the two groups. But if we look at the latencies, we find significant differences in the face test on the right, and a tendentially significant difference in the eyes test, indicating that the ASD children need more time to judge the appropriate words than the typically developing children in order to achieve the same accuracy. So now let's look at the explicit TOM abilities, the false belief tasks. For the first, here we have a little bit more participant participants because we could include the children between 4 and 8 years too. So we had 15 children in the typical developing group and 15 in the ASD group. For the first order false belief task, we found a ceiling effect. Nearly all children solved all 10 false belief tasks, except for 2 children with autism spectrum disorder. But also these 2 at least solved 7 out of the 10 first order false belief tasks. Second order false belief tasks, here the ASD group tendentially performed worse than the typical developer, the typical TD group. Okay, our conclusions are, we would like to refer to an old distinction that was put forward by Chomsky in 1965, where he made a difference between competence and performance. He was, as a linguist, he was trying to explain the fact that native speakers of a language are perfect in judging the grammaticality of a sentence, but they're so poor performers in everyday life when they utter sentences. And his conception is that the native speakers have the competence that they can show under ideal conditions. And maybe that's also the case with our experiment, that our children have, the ASD children have the TUM competence exists, and they could show it in our experiments because they had ideal conditions. There were no time limits, there were no dynamic change of stimuli, we gave them detailed instructions, tasks are well defined, and specific questions are asked. And they had no other cognitive load. However, these optimal conditions are not met in everyday life, so impaired performance may happen there and cause many heavy problems there. Future directions, our investigations now concentrate on conditions that impairs performance. Especially we use time-limited stimulated presentation or dynamic movies of emotional facial expressions in order to see whether performance, or whether these factors also lowers performance in this group. For the intervention, it's nice that there's no total lack of competence, but only bad or not so good performance. And as every skill maybe can be improved by training, and that makes us confident that our TUM-related social skills training will also improve their skills according to theory of mind. Thank you.